First at 5, a new dismal milestone. The United States surpassed 8 million recorded COVID-19 cases today. Good evening. I'm Samantha Jones. Today, even as health experts warn case numbers will continue to climb as we enter flu season, President Trump claimed the country was rounding the turn.
The light at the end of the tunnel is near. We are rounding the turn. I say that all the time. Some of the media doesn't like hearing it, but I say it all the time. We're rounding that turn.
Here are some of the other coronavirus headlines happening in the bi-state. In Illinois, they set a new 24-hour record for reporting cases with more than 4,500. In Missouri, Kansas City is reporting they're seeing surges in cases so high, some hospitals are refusing ambulances due to the lack of space. Also in Missouri, a new high positivity rate at 18.3%. Missouri is also on the top 10 list for other COVID-19 stats, the rolling 7-day average for Missouri cases each day and the number of deaths each day. Russell Kinsall asked the governor what's being done to get the numbers down. He joins us now live in St. Charles. Russell.
Well, right now I can tell you that the Missouri National Guard is into its final hour of COVID-19 testing here at this test site in the parking lot of Family Arena in St. Charles. But as you said, unfortunately, the numbers tell a very troubling story about the pandemic's impact in Missouri.
It was very curious. It's very convenient. That's it.
Some people came out to get a COVID-19 test out of curiosity, others out of necessity.
I got a call this morning that our office was shut down. I work for an eye doctor, and one of the girls tested positive, so they shut us down, and we have to go get a test.
Testing sites like this one are showing Missouri has a positivity rate of over 18%, one of the highest rates of infection in the country. But other numbers show the state in the top 10 for other troubling reasons. The daily rolling 7-day average of new cases in Missouri is 10,910. That's the 7th highest in the country. And the daily rolling 7-day average of deaths in Missouri is 62. That's the 4th highest in the country. I spoke with Governor Mike Parson about the numbers, and he focused on the death rate instead.
When you go back to April and you know the death rate in the state of Missouri was at 8%. And now I think the last numbers I've seen, it's at 1.6, 1.7.
To slow the spread of the virus and save lives, the governor stressed how everyone has a responsibility. He said people have to wear masks and use social distancing, but he admitted he was concerned about the rising rates of hospitalization.
And we're concerned about that. I mean, that's something we got to look at. But again, we got plenty of capacity at this point. It's more isolated areas that have to deal with that. Southwest Missouri, down where I'm from, is one of them that's kind of getting the hardest.
The Missouri National Guard is wrapping up at 6 o'clock the testing here in St. Charles, but they will be back out here again tomorrow from 8 until 4. Now, the governor said that everyone who lives in the state of Missouri can play a role in slowing the spread of the virus. His message to everyone in Missouri coming up all new on News 4 at 6. Live in St. Charles, Russell Kinsall, News 4.
At 6, Russell, thank you. When News 4 spoke with Missouri Governor Mike Parson earlier today, he said the rising positivity rate was due to more testing. But on News 4 at 4, the head of the Regional Pandemic Task Force explained that's not necessarily the case.
It's not necessarily that it's the number of cases. We know if we test more, we're going to see a higher number of cases, but it's the proportion of cases that are positive that's important.
After already seeing more than 850 COVID deaths, St. Louis County is now averaging 1 new death a day, and now at least 200 people are diagnosed with it every day. Today, St. Louis County Executive Dr. Sam Page spoke out against those who diminish the hard work of healthcare workers.
No one with any compassion should be trying to undermine or challenge the credibility of our healthcare workers in hospitals, taking care of patients in the ICU, patients on ventilators, who are there because of this virus.